Radio.
PrEP is a daily pill that can significantly reduce your chances of getting HIV. And typically, it takes a trip to a physician to get it. Now, you can visit select pharmacies, get tested on the spot, and walk away with your first month of PrEP. Plus, you'll also walk away with a $50 gift card after you complete your pharmacy visit. It's easier than ever to protect yourself from HIV. To find your nearest participating pharmacy, go to doh.wa.gov/PrEP now. From the Washington State Department of Health and Public Health, Seattle, and King County.
This is Big Poppy, host of Jazz from the Cabinets. Join me each week for a listening tour of the first century of jazz, an eclectic mix of Dixieland, big band, cool jazz, bebop, contemporary jazz, world jazz, all jazz in all forms. That's Jazz from the Cabinets with Big Poppy on Rainier Avenue Radio, streaming worldwide on RainierAvenueRadio.world.
Wash your hands, don't touch your face, wipe things down, clean up your space. When you cough and sneeze, do responsibly. If you feel you're getting ill, isolate at home and chill. No, you're not alone. Please pick up your phone and call 206-477-3977. King County 206-477-3977. Public Health 206-477-3977. King County 206-477-3977. Public Health Community Radio Station will provide you with more information. Say Rainier Avenue Radio. Your community radio station will provide you with more information. Rainier Avenue Radio.
You are listening to Rainier Avenue Radio,
your community radio station.
Welcome to Rainier Avenue Radio.world. It's me, Tony B. I am your host of the coronavirus special, the impacts of the coronavirus on South Seattle and surrounding communities. Boy, we have done over 250, almost 300 of these shows tackling the coronavirus in the many ways that it has disrupted our lives. And it's still here. This is the third pandemic winter. Yeah, the third pandemic winter. A few years ago, there were a number of different operations taking place. I think Operation Warp Speed is the Trump era program that poured billions of dollars into developing COVID shots. It just was like this new era of vaccine making that was going to happen. But that's kind of slowed down. COVID hasn't slowed down. You know what? Maybe it hasn't slowed down. Maybe the vaccine making hasn't slowed down. We're going to bring somebody on, who can tell us about what's going on now as we approach again the third winter pandemic. Joining me on the show is Dr. Tricia Egwuatu from Kaiser Permanente. I want to make sure I said that name correctly. Dr. Tricia, how are you doing? Oh, I guess she's not here yet. Well, Dr. Egwuatu will be joining us from Kaiser Permanente. I'll tell you what, let's take a quick break and then come back and see if we can work out getting Dr. Egwuatu here with us on the impacts of the coronavirus on South Seattle and surrounding communities. With me, Tony B. Rainier Avenue Radio.
PrEP is a daily pill that can significantly reduce your chances of getting HIV. And typically, it takes a trip to a physician to get it. Now, you can visit select pharmacies, get tested on the spot, and walk away with your first month of PrEP. Plus, you'll also walk away with a $50 gift card after you complete your pharmacy visit. It's easier than ever to protect yourself from HIV. To find your nearest participating pharmacy, go to doh.wa.gov/PrEP now. From the Washington State Department of Health and Public Health, Seattle, and King County.
This is Big Poppy, host of Jazz from the Cabinets. Join me each week for a listening tour of the first century of jazz, an eclectic mix of Dixieland, big band, cool jazz, bebop, contemporary jazz, world jazz, all jazz in all forms. That's Jazz from the Cabinets with Big Poppy on Rainier Avenue Radio, streaming worldwide on RainierAvenueRadio.world.
Wash your hands, don't touch your face, wipe things down, clean up your space. When you cough and sneeze, do responsibly. If you feel you're getting ill, isolate at home and chill. No, you're not alone. Please pick up your phone and call 206-477-3977. King County 206-477-3977. Public Health 206-477-3977. King County 206-477-3977. Public Health Community Radio Station will provide you with more information. Say Rainier Avenue Radio. Your community radio station will provide you with more information. Rainier Avenue Radio.
You are listening to Rainier Avenue Radio,
your community radio station. Rainier Avenue Radio, your community radio station will provide you with more information. Rainier Avenue Radio, your community radio station will provide you with more information. Rainier Avenue Radio.
You probably have questions about COVID vaccines. Here are some answers about how they're being made.
How are COVID vaccines being produced faster?
Usually, vaccine testing and production are separate steps. But because of the pandemic, vaccines are being developed on parallel tracks. So both steps are happening just at the same time.
How are the vaccines being tested?
Right now, several different COVID vaccines are in testing. Each go through multiple clinical trials with up to thousands of volunteers.
How do vaccines get approved?
Not all COVID vaccine versions will make it to the final stages of testing and approval. Produced vaccines that do not pass clinical trials will be destroyed. But for those that do pass, a team of medical experts will examine test results and possible side effects. If the vaccine is effective and safe, it gets approved and gets to you. Go to covidvaccinewa.org to learn more. A message from the state of Washington.
Women are not an homogenous group.
We face discrimination differently depending on factors such as ethnicity, age, socioeconomic status, and more.
Rainier Avenue Radio is proud to amplify women's voices.
They are the experts of their own lives, initiating conversations within their community about challenges they face, the solutions they're working on, and the opportunities they see.
Please join us this Sunday from 2 to 5 for Women's Voices on Air. We know our challenges. We are the experts of our lives.
We are master multitaskers, prioritizing our family, friends, and our faith above our own needs.
Our needs and voices are too often overlooked.
Please join us this Sunday from 2 to 5 p.m. for Women's Voices on Air.
We tell our stories in our own way.
1, 2, get down!
What's up, big and little homies? This is Masvita Maraire, host of Seattle Sports Weekly on Rainier Avenue Radio World, your one-stop shop for Seattle sports. We cover preps, we cover college, we cover pro, we cover it all. Huskies, Mariners, Seahawks, Garfield, South, Roosevelt, Metro, King County. This is where you want to listen to for all the sports that's happening in Seattle. Seattle Sports Weekly on Rainier Avenue Radio World.
This is Rainier Avenue Radio World.
Welcome back to Rainier Avenue Radio World and the impacts of the coronavirus on South Seattle and surrounding communities. It's me, Tony B. We're approaching Thanksgiving. I think it already is the holiday season. Mr. Bellis, is it the holiday season? I mean, this thing didn't used to start until Thanksgiving, but I think the holiday season, man, if you were watching television, it all started in like September. Walked into anyway, it's the holiday season. It is the third winter pandemic. Is this going to be something that is regular for us? Well, this is the third one. We've had a number of different vaccines that have come out. You remember early in the game, Operation Warp Speed, and all of the vaccines, the billions of dollars that were poured into vaccines, and very quickly they came up with a vaccine. This used to take a lot of time, but the process, and again, they explained to us how they came up with the vaccine so quickly over something that used to take a longer period of time. But we haven't heard about that much anymore. So that might be one of the things that we talk about too. Either way, right now, I'd like to bring on Dr. Tricia, and I want to make sure I'm saying this correctly. Egwuatu, Dr.
Hi.
Did I say that correctly?
You were close. It's Egwuatu.
Egwuatu.
Yes.
Oh,
that's perfect.
How are you doing?
I'm doing good. Sorry, we had some internet connections earlier, but we're making this work via my phone.
All right. Well, thank you for joining us on the program. Let's first, and you're with Kaiser Permanente.
I am.
Let's first get started by talking about who you are and the work that you do. Let's find out some information about you, and you can share some background as well. Now, I have a bio on you, but I'd rather hear you talk to us and share than me just read a bio.
Yeah, no problem at all. So my name is Patricia. I go by Tricia Egwuatu, and I actually grew up in Auburn, Washington, so South King County. And I'm also the daughter of two immigrants. My dad's Nigerian, Egwuatu origin.
Really Rainier Valley. That's really Mount Rainier Valley.
Very true.
Go ahead. Yeah.
Yes. So my dad's Nigerian, my mom's Ugandan, and I grew up down in Auburn. And I guess that's really where my story starts in terms of my cultural upbringing. My reasons wanting to go into medicine is that, there was a lot of people that did not look like me. And I want to help advocate for not only my family, but others in the community in terms of having access to healthcare and someone that looked like them and could help them and understand their stories. So that's kind of just carried me throughout where I'm at now. So I'm at Kaiser Permanente. I trained at the University of Washington for family medicine. And now I am a family medicine physician, but I'm also a faculty attending. And my primary responsibilities and what that means is that I teach residents physicians, and my focus on racism in medicine. So basically the understanding of why is there racism in medicine, and that transcends in terms of how patients get care. And I also teach a course at the University of Washington right now on healthcare disparities in African Americans.
All right. I want for anybody who may be unfamiliar as well. Let's do this. Tell us about Kaiser.
So Kaiser Permanente, people know as formerly Group Health, is Kaiser Permanente came in and purchased Group Health, and it is basically a primary care home model, basically a place where you go and get health care for all. And we take patients from birth until adults or elderly, and we provide all sorts of services. So when you think of the end all be all in terms of who do you go to when you get sick, we have hospital services, we do surgery, we do OB in terms of delivering babies. So that is Kaiser in a nutshell. And we are here in Washington, in King County.
You heard me call this the third winter pandemic.
Mm-hmm.
The third, am I wrong about that? I mean, just even saying the third winter pandemic, is that wrong? Am I on base, or is this something that we are approaching again for what I would see as being the third time?
No, I think you're totally correct. And I think, we think about it, COVID has been here. It feels like kind of forever now. We've been going through the waves of having COVID-19, but now we're also dealing with the flu and RSV. So it's basically a sick season that's even it's pretty bad, gonna get bad. So yeah, I agree.
And something I want to hear. I also spoke earlier, and you correct me on this again if I'm wrong. I remember when this all started, there was a ton of money poured into just vaccines in general. Obviously, COVID was the major. Is that still happening? I mean, COVID hasn't gone away. Are we still are we still producing vaccines? Are we still looking into ways to slow COVID as aggressively as we were a couple years ago?
Yeah, I think when we think about it is that COVID is still here and very prevalent. And so with that, it's really important that we continue to find ways to end COVID as what it is. And so including that means vaccines. So we know that right now there's the new, the bivalent vaccine. And so what that means is that it's a vaccine, and there was one previously, but this one's basically new and improved because viruses will mutate over time. And so we need updated vaccines to combat viruses. And so this vaccine that is out allows basically the old COVID and the Omicron variant. And so we are still doing extreme measures in terms of vaccinating, and also just talking to patients in terms of how can you protect yourself and loved ones? Because we know that COVID hits everyone differently. And depending on what healthcare conditions you have, you may be at worse outcomes than someone that may be really healthy. So it's really important that we continue to do our part in terms of talking about COVID, being vaccinated, practicing healthy outcomes to prevent COVID from spreading still.
And you said something that I want to follow up on. Bivalent vaccines. Can you explain to us again, like I'm from Mars, what that is and why that is different from what we were talking about before, which is, we talked about the vaccines, we talked about the Pfizer, and the Moderna, but this sounds like a different type of vaccine. You alluded to it a little bit, but just explain to us so that we are clear on when someone says bivalent vaccine, what we're talking about.
That's great. And it's a big word. And I feel like that can deter people oh, it's another vaccine, but
yeah, it's like this $25 word that,
right? I feel you. Definitely. So when I think of viruses, is that viruses are smart. They can mutate over time. They get in the little cells and they create new variants. And that means that, the old COVID virus that's still there can mutate and hit people, or people can contact it. So that means that the vaccines need to be updated to reflect that. And so now this vaccine is being able to basically protect you from the old and the new. So bi meaning two, bivalent. Yeah. And so that's also when we think about how the flu shot every year comes out and there's a new one, and that's because it has to be updated to reflect what's going on within the community.
Okay. And so that's what the bi in front of it, it just means two. So,
Yeah.
Wait a minute.
Yeah, I can see it.
Okay. 2. There we go.
Yeah.
2. And I'm trying to vision out into the future, but not get too wonky with this.
Yeah.
So as COVID continues to mutate, does that mean that the vaccine will have to continue maybe we'll have a trivalent vaccine at some point? Am I doctor here?
Our thought process is exactly the same. I'm like, I'm thinking, I'm like, oh, man, this thing is here to stay. And so that means that things will have to continue to improve with time. Not sure what that means in the future, but I like feel your guess and my guess is probably like, yes, next year might have another one. But that's kind of like how things have gone when we've seen various vaccines. Things continue to improve. We have people that are great scientists that are doing the work in the background to make these updates.
Okay. Now come some of the questions that folks may have who are listening. Like, well, does this mean the old vaccine no longer works, is no longer effective? If I got the I don't know what to call it, the vaccine that we're talking about here.
Yeah.
Is it less effective?
No, I mean, it's going to be effective in different ways in terms of you never can predict what virus like you're going to get. So for example, like I got the COVID, I would say like the old vaccine right before the bivalent came out. I was like, man, but you know what? I was like, I'm still protected. If I get COVID and get exposed to it again, I've been boosted. So I understand like people's like everyone wants the best of the best, but sometimes unfortunately they are not like able to get that. And so with time, well, hopefully everyone will just be getting the same one.
Okay. Now I'm going to keep using this word bivalent. Is that right? Am I saying it correctly?
Yeah. Yep.
Just, maybe this is something else that's going to have to become part of our lexicon, part of what we do, part of who we are. Now, is everyone eligible to take this vaccine? Is there enough for should all of us be taking the new bivalent vaccine, or again, is this something that is for those who are over 18? Do we know how this works at 12 and over? Do we know it works at 6 and over?
So each
and younger.
Great question. So if you have completed the initial series, you are then eligible for the booster, and that includes Moderna or Pfizer. And right now there are demand shortages, and so so not everyone's going to offer kind of the same, but if you're able to get it, that's fine. And they will be able to, given your age, your healthcare, basically background or problems, be able to help triage that in terms of like working with your physician specifically. Like we know that younger kids are going to have different variations because of just the vaccines that are equivalent for those kids. So I would say to be specific is like to really work with your physician, or like if you can get the pharmacy or local health community clinic, they will have those like specific answers.
Okay. So you can't tell me if you're 65 and older, you're eligible.
Yes, I can say that. Definitely. 65 and older, you are eligible. If you have high chronic conditions, immunocompromised, yes. And so, like when we first saw the vaccine, like it was being pushed out to certain groups, and those were usually the groups. And then it tinkers down to like, young and healthy. And then it came to kids later. So that's kind of like where it is like, yes, everyone's 65 and older, but I want everybody to get it too. So everyone's eligible, but then they might stratify it in terms of like where you are in terms of age and healthcare conditions that you have.
And so this includes school age as well, K through 12. Eligible for the new bivalent vaccine. Yes.
Yeah. So kids are going to be a little bit different, and I can't speak directly towards that. And that's like really working with that population, but there are specific, and that's because of different trials that have come out for kids. Some are getting like 1 and 2 shots. But for kids, it's a little bit different for them.
Okay. And again, I mentioned, and we're moving into the winter. I call it the holiday season. People move indoors. People start to gather more. And well, let me do this first. Okay. Is COVID-19 a respiratory disease?
So people can have respiratory symptoms, yes. And so, yes. And I think the part about that is that as we're getting indoors and we're around more, we still got to be aware of like flu and RSV too. because those can present similar respiratory symptoms. So like coughing, sometimes people will see congestion, runny nose, sometimes fever. So it's so interesting because right now is the time it's like we can see so much varieties, and so people should still get tested for COVID if they feel like they're getting sick as well.
So because that's what we've known, or it's what I'm calling respiratory. And that feeling initially, and then of course we know that there are other symptoms, and some of those symptoms are actually deadly, have led to death. But if it's the same deal. If you feel coughing, if you feel like you're catching a cold during this time of the season, this could be COVID.
Yes, yep, exactly, COVID. And so sometimes like when I'm talking to patients and they're like, I'm experiencing this, and that. I'm like, well, have you tested for COVID to make sure that's not COVID? Because if it's not COVID, then we could think, okay, maybe it's like a common cold caused by a virus, has similar symptoms, could be something else, but still we want to make sure that things are not COVID.
Okay, and you said something else that I want to get an explanation on, Dr. Egwuatu. I just need to get answers to stuff. And RSV. I've heard of the flu.
Yeah.
You said RSV. What is RSV?
So RSV is a respiratory syncytial virus. It's a hard word, and that's why we just say RSV because I can barely pronounce it as well.
Okay. Run that back one more again. All right.
Okay.
What is it?
So respiratory syncytial virus.
Okay.
RSV.
And that's something different than the flu?
Different from the flu. The flu is caused by another virus. And as we're talking, I'm like, man, viruses just do a lot. And yes, RSV is another virus. And we kind of hear about it because lots of kids tend to get it, especially like if under age 2, a child probably has gotten it. But this season, we're really seeing that it's just spreading throughout the community as we're congregating more. And the thing about it's like it causes the common cold symptoms, including respiratory, so coughing as well, congestion, runny nose. And so that's the hard part about that is also like the most like as treatment. When I hear about this, I'm like, you have what we think is like the RSV, and the way to treat it most often is like doing things at home. It's like staying hydrated, getting rest, eating healthy, and other things you can do in terms of the symptoms you have.
We got started a little bit late, and we're almost out of time, but I'm going to go a little bit over.
Okay.
If you don't mind, if that's okay with you.
Yeah.
Because this is tricky. You know what I'm saying? The flu, we're used to. You get into this cold season. COVID, we just figured out the same thing. This thing is not going away as it moves into winter. It's coming back. Now we're finding out there's a new vaccine. Then we're hearing RSV. I'm gonna just go ahead and run that $25 word back by me again, just because we got to figure out what is the RSV again?
Respiratory syncytial virus.
Okay, now between the three of those things, well, let's start with RSV. We know that for COVID, you can take the vaccine. To stop with the flu, you take a vaccine. With RSV, do you take a vaccine?
No. Yeah. So, and you think about like other common, like you would get colds all the time. We don't take vaccines for those, right? Because our body gets exposed to them. Our body is great. It can fight things off. And this RSV is like most commonly you're going to fight it off. And that's like the hard part about that is that like it can be so similar to the other two, but yeah, no vaccine.
Oh boy.
Yeah.
You're
I hear you.
To the impacts of the coronavirus on South Seattle and surrounding communities. It's me, Tony B. My guest is Dr. Tricia Egwuatu from Kaiser Permanente. We're talking about COVID, getting into, again, understanding, I'm calling them respiratory. I'm trying to be clinical about this, but at the same time, speak to folks in common language that everyone can understand. So at the end of the day, if you're feeling like you have something, that just might be a common cold. But it could be these other things.
Mm-hmm.
What can you do, especially during this time of the year? First of all, to prevent what is sounding like this is sounding different than it did a couple years ago. Dr. Tricia was like, okay, and we just have to protect against COVID. The flu's out there. We got to learn more about COVID. Now it's like there's all the anyway. Over the holiday season, is this a real threat? And what are the reasons why this threat is increased over the holidays?
Well, we talked about like, congregating more or more indoors. And the thing about it is that like, let's say me and you got it, we could have mild symptoms, but it affects everyone differently. So like if you're a kid and you get it, they could be okay. But sometimes if like signs and things to think about is that like kids take things differently, and as well as immunocompromised people who are older. So if the people start to become like lethargic, they're not eating, they're getting more wheezy, they're looking pretty ill, that's when we get worried and they need to go seek urgent care. And that's the problem, is like these things affect everyone so differently. And if we're going to be indoors, we need to be cautious about it. So practicing like healthy habits in terms of like wearing a mask or not going places if you are sick so you don't spread it to other people, like washing your hands. Like the sneezing and coughing is the worst part because that stuff just spreads everywhere. So it's just being really cautious. And, I was just, telling my brother who recently traveled, I'm like, and he got home, he's like, what can I do now? Like, he's worried. I'm like, you got to get some rest. You got to get your body the stuff that it needs to thrive and not get sick. And so that's as we can try to be as good as we can be.
And I know you want to talk about what I'm about to bring up here as we enter the holidays. It's a lot of fun, but it can also be very stressful.
It can.
I gotta buy gifts. I gotta go to this, work party function thing, and do all this stuff that's associated with the holidays. Does the level of stress increase the potential, or does it for getting what I'm calling one of these respiratory, the COVID or the flu or RSV? Does it increase again? You talked earlier about chronic diseases that we have and the impact that they have that may make you eligible to get the bivalent disease. So let's kind of combine those things now and take a bigger picture. Does that add to the potential, your risk for getting one of COVID, RSV, and the flu?
Yeah. I mean, when you were just naming that all off and stress, I got stressed in terms of like the holidays. I'm like, oh my gosh, there's all these things coming up. And when you think about that, stress impacts us all so differently. So people can, increase in anxiety, increase in depression. It can make you're not getting enough sleep, right? So your body starts to get more worn down. And then if you get exposed to one of these unfortunate viruses, you're more likely to probably get it and then have to go through everything that comes with it. So saying all of that, it's important. Like the holidays are amazing, right? But also stress impacts people. So being mindful of that. So if we know we're going to be in stressful situations, it's like, I think it's a really great time to get in tune with like what's good for you personally and like how can you go through those stressful moments. So if you need to exclude yourself from certain activities, you need to get more sleep, you need to stay like up on, nutrition and exercise. Those are things so that we can do to help with that.
Okay. And again, some folks might be thinking COVID, stress, whatever we're talking about, potentially high blood pressure. Now you're connecting all these other things.
It's a big circle.
To this, again, what I'm calling the third winter pandemic. What I'm getting at is I don't want to be Chicken Little here, where, the sky is falling, but we're on the air talking about this for a reason.
Yeah.
Approaching this third winter pandemic, where are we at, Dr. Tricia, as far as maybe where we were 2 years ago, a year ago? What should be, where are we at? Why don't we just start?
I mean, when I think about where we're at is that we're in the midst of this pandemic that came in and changed everyone's lifestyle in still in different ways. And people are still feeling, And I think people are feeling the impact of that. And that's either, job situation, financial, health. People have lost loved ones. And I think we are still feeling that. And people are grieving within COVID. So I think it's okay to be mindful, like this has been really hard and we're still living within it. But then I think, that we've come a distance from it. We're still within it. And so I think it's still holding space for that. But like we're existing, people are thriving in situations, but still taking care of yourself and being mindful that you can get sick and to be cautious about that. I think we all are practicing our health a little bit differently and how we take care of ourselves as well.
You are listening to Rainier Avenue Radio .world. It's me, Tony B. This is the impact of the coronavirus on South Seattle and surrounding communities. My guest is Dr. Tricia Egwuatu of Kaiser Permanente. What do we know approaching this season about the impacts? Are we still in a situation where those who are Black, those who are people of color, those who are not making as much income are still more vulnerable to these all three, but in particular COVID, and why? I mean, we've talked about this historically, you know what I mean? So we've talked about some of the reasons before, but why are we? First of all, are we still at that place where there are populations of our community are potentially, I don't know what it would be, more exposed, more vulnerable?
Yeah. Yes. Yes, definitely we are. And then that goes back in terms of what you were just naming, in terms of the systemic issues that are still at play that, have limited individuals in terms of our healthcare and healthcare disparities that Black and Brown people experience, and the racism that exists within the healthcare system. And so those things have not changed. And so that makes us more, bad healthcare outcomes. And that is to go through so many factors on why. And just as you're speaking, as I've been thinking, why it's in terms of COVID, it's hit us financially, access to healthcare, where do people live, food security. There's so many reasons why it's still going to continue to impact us. And I feel like that's a whole other conversation. It's like, what are we doing to go through and to help those situations? So yes.
I was hoping for something different. I was.
I know.
Maybe I was just being hopeful, that the people who were catching the hell at the beginning, maybe we're having an easier time of it now because of what I would thought we would have learned, even, especially with healthcare.
Yeah.
And those issues that impact, again, those who are Black, those who are people of color, and those who don't earn as much money as other people.
True.
That our healthcare system has not, and maybe, I don't know if you want to, our healthcare system has not adjusted as we move forward so that we don't continue to have those same loopholes.
I think we have adjusted. And I think we are still growing within that space. And I think that comes in terms of, when we name that, is that healthcare is doing better and we are offering better services in terms of our outreach to our community, access to healthcare and appointments in our community relations. So yes, healthcare is adjusting and, and the spectrum of the space that I am in terms of educating other, physicians and working with people to be these things exist and what are we doing? And we are working in the community, but I do not want to say that, no, it's not it has 100% shifted, because we still have room to grow. And this has been an issue systemically since 1400. So we are still growing within this space, definitely.
Well, I appreciate your honest answer. You know how, maybe you don't know, but when on this show, this is how we get down. We have honest, open, frank conversation. And I can tell you that over the past 3 years, at least, from the community members that I've spoken to, concerns about healthcare have not gone away.
Yes.
and so, I mean, we have to bring that into the discussion as well. At least that's where I sit. So again, I want to kind of do a review here because we talked about some of the things opening the show. There's another vaccine, but it's a new vaccine, but it's not really a new vaccine. If you haven't had your booster shot, you might be eligible to take it, but there's not enough necessarily to go around. Boy.
But get it if you can get it.
But
and everyone should get it. Yes.
If you can get it. And we're talking about this thing called if you hear this word, bivalent vaccine, right?
Yes.
Which is the same except super, because now it does two things instead of one thing. Did I get that right?
I like that. Yeah. Better and improved and a lot of things are being better and improved all the time.
And again, just to talk about this, what about the safety of this bivalent vaccine? Do we know that this is safe, that there aren't any secondary effects that are going to happen that folks are unaware of? Nobody's going to grow an extra leg or something like that? Has all the testing been done in the same capacity to ensure that this is as safe?
Yes. Exactly. I think, when we think about the original COVID-19 vaccine, when it came out and questions and speculations, and so I would say, it has gone through the same process as previously. It is safe, but I think it's really still great to have a conversation with your physician or a provider in terms of what are, potential to answer all those questions that people may have. And so they can feel safe moving forward with that, with having I feel a balanced conversation about it. And I think it's okay to have those questions.
Okay. You may not be ready to talk about this right now. We're almost out of time, but I'm going to bring it up anyway.
Okay.
If you get COVID, you have it now.
Okay.
Is there something that you can take that will lessen the impact, that will, you know what I'm saying? Is there something you can take now?
Yes. And so often people will call or make an appointment in terms of, I got COVID and can I take something, basically an antibiotic? Most people will ask for COVID. And there is one, and it's specific in terms of certain age groups. And also if you have certain conditions that will qualify you for it. Well, now with anything that you did take, it's good to run through with your provider about okay, if I did, what are potential side effects for it? So it's making sure that yes, there are things that you can take, but working with your provider to see if this works for yourself.
In your opinion, are we doing enough to combat these respiratory diseases, COVID and its multiple variations?
Yeah.
I mentioned earlier that initially, maybe we just heard more about it, about all of the money that was pouring into vaccines.
Yeah.
Have we as a country, is this something that, whether it's been for governmental, have we backed off of COVID and respiratory diseases?
I think, I think personally, we're not hearing more about it. So yes, that means that there's been different strategies of how we've talked about. I think when we first had COVID, it was everywhere and anywhere. That's anywhere I'm talking about. But now in the media, no. But I think the reason why, we're having this conversation now is that we realize that it's not gone away. It is still prevalent. We still need to keep having these conversations and discussions about COVID, now RSV, now flu, and how it's impacting people. And I think we can definitely do more. And I think it just starts with these conversations and being aware. I try to when I'm having, my patient conversations, hey, the holidays are coming up. Please be safe when you're congregating with your friends and loved ones. These are measures you can do. So I think we have to do more. It's still prevalent and our communities are being affected by it. And so we're seeing that as we mean in terms of our Black and Brown communities. So being mindful of it.
So we have vaccines. We have bivalent vaccines.
Me too.
We have something that you can. Would you call it an antibiotic if I use it as the term antibiotic?
Yeah. So because COVID is a virus, so it's an antiviral. So, but they're so interchangeable. So when people are talking about I know what they're saying, I'm and that's how I usually answer because things are named so differently and affect people differently. So it's okay to say antibiotic.
Okay.
Yeah.
But even with the advancements that we've made over the last 2.5, 3 years, this is still an issue. Is that what you're telling us?
Yes. Yeah, it is. And that's why we are seeing advances in the vaccine. We're talking about how we can, work together as a community. And it definitely is. And we still have to play our part in terms of making sure that we're not spreading it and doing what we can to also stay healthy as an individual
Okay.
or
And
individuals.
I said review. We went over bivalent and what that means. I'm going to go back over again the flu, which is still there, right? And RSV. Just kind of a review for anybody who may have tuned in late about these 3, and I'm calling them respiratory diseases, and I'm not a doctor, but as we approach the holidays, again, just kind of a review of what folks should be aware of and what they can do to be healthy. Keep your family members healthy as well, and your friends, as we again winter the 3rd winter of pandemia. I don't know if that's a word, but
I like it. It's a good one. And I think it is a word too.
What can we do?
Yeah, so I think it's just to summarize and think of things as, being as healthy as we can, which comes down to being mindful. If you're sick, stay home, get better. Practicing healthy measures. So when you think out in public, so like, hand washing, hand hygiene, and then wearing a mask if you are feeling ill to spread symptoms. And then, staying healthy in terms of exercising and what are we eating, and then reducing stress levels. And that comes in so many forms in terms of like, wellness and what we can do. So I think just being very mindful that as we go into more of this holiday and winter season, that things are spreading. Just like the cold, like you don't want to get sick. So like, what do we do to not get sick? And that's just being also mindful who we're around. And I think if we do those things, we will have better outcomes and hopefully just get through the season. And we'll have another conversation about this later too.
My guest is Dr. Tricia Egwuatu from Kaiser Permanente. Thank you for joining us and revisiting this and again, recreating the awareness I think that we need to have about this thing so it doesn't turn into a situation, again, that impacts those who are most vulnerable even more. And I want to give you the opportunity for final words here as we've had this conversation. If we've missed something or if there's something that you want to share with our listeners and those who are watching and listening. So yeah, final words.
I just thank you for the opportunity to be here, and I am happy to share and to also like be of service in terms of my community. This is why I'm here, to help talk about these things, to spread the awareness and also address the disparities that exist. And so thank you. And I know this is a hard season for all, and we're all trying to do our part. And I thank everyone for trying to do that as well.
All right. Well, thank you for being here. Don't go away yet, because I'm about to do some shameless self-promotion for Rainier Avenue Radio, and you can be part of that. Tomorrow, because just a couple years ago, Tricia, there were no folks allowed at high school football games. Well, now that's completely different. And it's a cool thing because it's great to see parents, family, and friends come out and support high school football. But it's another one of those things where the weather's colder. Now we're gathering. At least it's outside.
True.
But still we need to be. I say that because this is the quarterfinals. Quarterfinals?
Yay.
And of the state championships. And we will be broadcasting live this Saturday at 1:00 from Memorial Stadium as number 11 Stanwood takes on number 3 O'Day. That will be at 1:00. That'll be myself and Yasutaki the Younger on your analysis. And then at 4:00, we will be broadcasting Ferndale, number 7, taking on number 2 Eastside Catholic. And so it's going to be a lot of fun. But by the same token, Dr. Egwuatu, we want to remind everybody where you're out there cheering and yelling and screaming to be safe. How much of a difference does outdoors make? The fact that these games are going to be taking place outdoors, is that a little better?
It is better, but it's cold, so everyone bundle up, stay safe, and stay warm as well. If you're feeling ill, I'd probably stay home. When you are cold, your body kind of reacts a different way. But it's a lot better when we think about when COVID first started. It's like we were gathering outdoors, which was nice. So I would just say, just be mindful, stay warm, and stay healthy.
All right. Thank you again for joining us. We'll have to do this again. You know. And
this is great.
And glad to get the opportunity out. And I appreciate you having again frank, open, honest conversation.
No problem.
with us right here. That's it. That's all the time I have. That is going to do it for the kid. It's me, Tony B, saying, remember, whether you believe you can or whether you believe you can't, you are probably right. I'm out. Peace.